Right, back live tonight here on In Focus, and thanks for staying on. Critics say the National Health Insurance Scheme will be disastrous for South Africa. The National Assembly passed the bill on Tuesday with the aim of providing universal healthcare coverage for all. The bill will now go to the National Council of Provinces for approval before it lands on President Cyril Ramaphosa's desk for consideration. For more on the NHI bill, we're now joined in studio by the ANC Youth League National Organiser, Zwelo Masilela. Zwelo, good to have you, and thank you very much for your time.
Thank you very much, and good evening to the viewers at home.
Are you going to conference?
Definitely, we are going to conference.
Are you sure it's going to happen this time?
I'm very much sure. As we speak, I'm from office.
Yeah.
Even after this interview, I'm still going to go to office to do some work preparing for the Congress. It is certainly happening on the 30th of June to the 4th of July this year.
Yeah. So I thought, let's talk about one of the issues that are topical. I know there are a number of discussion documents on the various degrees of policy, economic development, and so on and so forth. But this is quite topical. It's been discussed, and people are saying we'll never get this right because of just the quality of our healthcare system. Why are we failing to present an impressive picture in the view of the ANC Youth League when it comes to the health system in our country?
Look, largely that could be attributed to the impact of the inequalities as it relates to our people in accessing health care. You would understand that currently as it is, our health system is two tired. It's for the rich and for the poor. And about 86% of the people of South Africa are poor and can't afford private health care. Hence, this intervention of this bill and subsequently being an act will enable a much more integrated system to benefit and cushion the poor in the process. Of course, the concerns are there, as you would know that various consultations have been taking place leading up to Parliament and so forth and the processes. So of importance is the impact it will have on the poor and the majority of this country. Yeah. Of course, still not undermining the concerns that are raised as it relates to the funding models and so forth.
Yeah, but why are we failing to improve quality? Just quality, because you can say private healthcare, you've got options, and that's what it provides. That's what you're paying for. But public institutions should at least, at bare minimum, be able to give us a degree of impressive quality in terms of what we're accessing.
This act seeks to address that because the intention here is to create a middle ground to merge the two existing systems. I can say two different systems, the private and the public sector. The quality, of course, could be affected by a number of factors. One of them may be the fact that the ability to get skilled and more experienced health professionals into the public sector, yeah. Because they could be more enticed by the various in the private sector the benefits and so forth. So of importance is to try to merge the two systems, because I would give an example that the latest COVID pandemic has shown us that a relationship or a coexistence between private sector and public healthcare produces the sort of quality that is lacking currently in the public institutions. So the COVID-19 pandemic taught us a bit of how it will best work this national NHI if it were to be implemented. It was sort of a sign that if we hold our hands together with the private sector and everybody else and all the role players, it will be of great impact to improve the quality of public health care, because the necessary skill, the necessary knowledge, and everything required to ensure that the quality improves will be injected into the system.
So if we practicalize and look at young people, considered high risk because, I suppose, of the energetic lives that they live, they're out there, more prone to take risk, more prone to drive faster, more prone to consume all sorts of things that would put their health at risk, right? So when we are talking about reducing costs, right, how do you protect the elderly who might have slowed down, and they are really trying to protect themselves from exorbitant healthcare expenditure, as opposed to then bringing young people into that particular kitty who are more likely maybe going to be using it more than the elderly would be using it?
I presume that may not be entirely and statistically accurate, that the youth will necessarily be of a huge impact or contribution due to their social behavior or due to social ills and so forth. I may not be sure of the actual statistics, but I argue differently that it may not really be caused by the youth, or the damage or the dent may not be much because of those social ills, as it were. So I believe that what is of importance is to say this act will be able, or this bill will be able, to comprehensively cater for all South Africans, young and old, and to ensure that every South African, in an event they need health care and provision, such will be of quality, and they will be of provided with such quality health.
Yeah. How do you propose we shape primary health care? Doctors are saying that's where we fail most. By the time we have to get to tertiary health care, hospitals and the likes, it's already too late. Right? So where we need to actually grab it is at community level, clinics, and where we need to strengthen our primary health care before things get out of shape.
Quite correct. And I think one of the things that government need to reprioritize and reinvest in is the building of new and more community centers, clinics, so that basic services of health services are provided at that level, so that the district hospitals and the tertiary hospitals and so forth deal with the challenges that affect, or the serious critical health issues that affect our people, so that hospitals are not crowded and flooded by people seeking basic health services. So we should ensure that community health centers have the necessary medication and all the equipment required to provide services at that level, so that we reduce the congestion at the level of district hospitals and so forth, and tertiary hospitals. I think we should be able to have that investment in terms of infrastructure first, and then of course the second layer will be that we ensure that the sort of required services and skills are provided in those centers, so that services get to our people.
You say in your document that government should fast-track legislation and regulation to deal with the 4 risk factors, including creation of a health care commission whose function is specifically to deal with the said risks: smoking, harmful use of alcohol, poor diet, and a lack of exercise. Why are you pointing these things out? You've just said it's not statistically correct that young people are at risk on these issues. You're mentioning it in your document.
No.
They are at risk on these issues, are they not?
They are at risk. Hence, I said we should not exclusively isolate them from the broader societal ills that confront our people. Because once we begin to do that, we would not be doing anything different that is relating to how the current system is able to segregate between the poor and the rich. Because now we will begin to say the next thing, it will be about women and children. And the next thing to be black and African and white, and it will be racialized. So let's box everything to South Africans and say let's have all South Africans receiving quality health care. However, there is sectors like the young people who have a certain class or social challenges that confront them: drug abuse, substance abuse, and so on and so forth, alcohol abuse, which should be combated. And we should not view issues like alcohol abuse, drug and substance abuse at the level of dealing with them now because they are now affecting our bodies or systems now as a health scare. We should deal them as a societal problem, because before I take drugs, before I get sick and admitted because of alcoholism and all other challenges, it begins at the level of my community and how I'm raised and how I'm brought up and how I deal with my social environment. So it's a social issue before it becomes a health issue. And even in our document on social policy, we reflect on such, and it cuts across to the economy, education, and health. So it's a broad spectrum of how society is brought up in South Africa. And we're interested in saying, how does a young person and how the young people of South Africa intend to conduct themselves through the spheres, as it were, mentioned. So before we get to the later stage where people now have to receive this particular healthcare, we should have dealt with it at a social level. So it's a cut across a process, because if young people are not at school, they're taking drugs. So it's an education issue. So if they are not doing sports and so forth in their communities, it's a social issue, and it gets to detriment to their health.
So, but you're arguing here that government should come up with regulations and legislation to fast-track this issue. Come up with a commission that is going to deal with these particular issues. What one could say, what is the healthcare commission going to do? You can't legislate social behavior. Right? You can't legislate that as we become a nanny state. So you're going to be running after young people and saying, no, don't drink, don't smoke, don't do this, don't do that.
Look, like I would have said, that it's a cut across. You can't really be a nanny state as you put it. But basically, what we're calling it a commission, it's basically to say, as we roll out the programs, somebody should be in a position to say, as we implement the system, we as a commission, we view certain mistakes. So because this is a new bill proposed and all of that, we prefer that there should be bodies, because we're introducing something that would have not happened in South Africa. It would have been annexed from or researched from other countries. And now we believe that having a commission of that sort, it will be able to safeguard the interests of the people of South Africa, more than babysitting, but really to have a body that looks into are things going on there, so that we don't have a situation whereby, because we're trialing this process, things get to collapse and the entire system collapses and the people of South Africa are affected. It is more about that, in my view, than about policing social behavior and conduct of people, as it were.
Yeah. Government getting into the pharmaceutical space, interventions in the pharmaceutical space is one of what you're suggesting as well. How exactly do you want? Is that a populist thing to say? Because, I mean, we nationalize everything. Let's nationalize pharmacies as well. No, we're dealing with the case, for example, now in the Northwest, where people just didn't bother to order incubators. I think it's incubators, yeah. And kids had to be put in boxes. You want those people to be in charge of getting us critical medication that could possibly save lives of the elderly in this country.
Look, the pharmaceutical space, it's a very critical body in the healthcare community in terms of dispensing this particular bill and so forth, particularly NHI. Now, it can be that the majority of our people who are represented by government do not have a participation, and it's a big, beyond it being a service in terms of provision of pharmaceuticals. It is an economic space of participation, because if you go back to our document where we speak about economic transformation, because we would speak about ensuring that all key sides of the economy, government and the majority of our people should be able to participate and to have some form of regulation that ensures that our people participate. Because as it is now, if you were to check the pharmaceutical companies that are providing the sort of services that gets into our institutions, it's international conglomerates, and there's a lot of price and coalitions in terms of inflations of prices. They are controlling the markets and everything. Now, an intervention from a level of government in terms of the pharmaceutical space, and it's a long-standing resolution that there should be a state-owned pharmaceutical company. And I think as the Youth League, we're pushing government to a corner to ensure that even if such could be a private-public operation, as it begins and finally, eventually, it becomes a state-owned pharmaceutical company, to ensure that the majority of our people who elect a government are able to have a representation in all key sides of the economy, including pharmaceuticals.
You're calling for the capacitation in terms of human resource. You're saying some kind of strategy as far as that is concerned. What do you think is at the heart of the many vacancies? Because we are told that there are doctors. The universities are churning them out, right? But government is just not hiring them. And therefore, because they're not being hired, they prefer to go somewhere else. So at least they'll work, and they'll work for peanuts. They're not going to sign up for that, having spent so many years in school. So, I mean, these are quite specialized areas that you're calling for: neurosurgery, cardio surgery, forensic pathology, and in all these areas. So these are people who would have spent a lot of time at school and would want to come out and be placed somewhere. But we don't have funded posts in this country.
It is part of the things that we are fighting for, and we continue to urge our government. And we're happy here in Gauteng, even tomorrow they are launching and ensuring that our people get to all the vacant posts are advertised. And we urge all provinces, national and everything, that such critical posts should be advertised and our people should be able to apply and get to have access to those jobs. But key to that, in terms of the particular skills that you are referring to, in addressing and ensuring that we have the national health insurance scheme, it will enable a competitive advantage, because now you will have a universal system. Nobody will say, if I go to the private sector or this other sector and so on, there is going to be benefits better than the other side. Now you will have a universal. If I'm a private, I'm a healthcare worker in a village in Lusikisiki, or I'm here in Randburg Center, I will still receive the same remuneration in terms of my skills. Now, that's what the NHI is about. And we should be supporting it because it addresses the very fact we are referring to, of the lack of shortage of skills in rural communities and rural provinces that provide healthcare, as it were.
Yeah, and how will that work? I mean, in practical terms, I mean, there are people, for example, who are saying the reason why I have a medical aid because I work hard and I want to make sure that I secure, my health. When I need to go to hospital, I know that I will get a hospital and there'll be medicines there, and there'll be a doctor there who knows exactly what they are doing, and that's why I'm paying medical aid. So how do you see it working?
I see it working because you have something that is working, yeah, and something that.
So we're still paying medical aid.
No. That's not what it suggests. Yeah. Now, what I'm saying is, what this suggests and how will it work is that those who are currently not paying will have access to what those who are paying are currently enjoying, and those who are paying will have an access or continue to have an access to what they are having. Now, nobody is at a loss here. Nobody is detriment. Now, the biggest issue here is that, and all of us should appreciate, is that our people will have an access to what was reserved for the poor without adding a cent from themselves. Now, for me, that is the first basis of the argument. Now, the second point on how will it work is the checks and balances on ensuring that the funds, because of critics, even the people who are criticizing the insurance scheme as it is now, they are criticizing it from an angle of lack of funds and management, not in terms of its nobility, in terms of implementation.
There's a trust. They don't trust. Now, states. There's another SOE that's going to be messed up. It just don't trust the government to do the right thing.
No. Look, this is not government alone. It's government working with the private sector, experience and all of sort of exposure to the space over the years. Yeah. Now, combining this experience and the capacity of government in terms of it rolling out in the far-flung areas and rural areas and communities, it will enable quality reaching to those levels, because the limitations, as it were, you relate to government in terms of quality affected. It is affected because certain things require some sort of specialized skills. And I think as South Africans, we should never be opposed to government working with the private sector, especially if it is to the benefit of our people. Like I initially made an example with during the COVID-19 pandemic. Yes. You would remember there was many things that were done together. By
vaccination and so
there was solidarity fund and all of those things. Yes. So it was a perfect example, and we should be able to emulate and bring South Africans around those traits of South Africa. By the way, South Africans have an ability and capacity to unite, especially when the rallying point is beyond, it's about the people, not about parties, political association and affiliation, because this is about our people.
I'm completely out of time, but coming out of your conference, give me one thing on health that you are saying you'll be willing to pin your head on, and you will fight for it in the bigger mother body until you achieve it.
It is that this scheme must happen. President Ramaphosa must sign it to be law, and eventually it be implemented. It must not gather dust. It's been long, it's been coming for years. It's been a subject of debate for years, and I think we should begin to talk about implementation and see the dust rolling and see it being practically implemented. And obviously we should not be reckless, should move in proper phases. And I think even the bill proposes such that we move in proper phases, and eventually we will grasp the process and ensure that our people eventually enjoy a basic human right of quality services enshrined in the Constitution and the UN Charter.
Zwelo, appreciate your time. Thanks so much for coming on. National Organizer for the ANC Youth League there, Zwelo Masilela.